Hi, it's Aja Simmons with It's Time Kids Children's Development Series, and we are back. We are back with a new development poster, and this time we are addressing brushing your teeth. There's a quick glance at our new poster. And brushing your teeth for infants can be a little challenging, especially to do it on a consistent basis. So the point of this poster is to show a representation of the foundation of what you need to keep your teeth clean. Of course, brushing your teeth, flossing, washing your hands at the end, and of course, celebration, right? So we have this poster for our little girls. This is our Rhea poster. And then we have this poster for our developing little boys, and this is the Trey poster. So with this series, I had the pleasure of talking to a pediatric dentist in our area. This is actually the dentist of my daughter. She has a facility. It's called Under My Pillow Pediatric Dentistry. And I had the pleasure of talking to her, and I learned so much. So let's take a moment and go visit Dr. Candace Grace. Candace Grace, and I am so excited to be here to talk to her about pediatric dentistry.
Happy for you to be here.
Well, if you want to take a moment to introduce yourself to our audience.
Okay, well, my name is Dr. Candace Grace, and my office is in Cypress, Texas. It's off of Tuckerton and Fry Road, right next door to the HEB. That's our flagship store in this center. I've been a pediatric dentist for about 10 years. Okay. I graduated from Howard University. I'm originally from Louisiana, graduated from Xavier University, got my master's from Tulane University. I've been in Texas for 10 years, and I'm like a native daughter now. I really love it here.
And she is my daughter's dentist, just to let y'all know. So super excited. But I wanted to ask you a few questions.
Sure.
So I hear mixed things, but like at what age should a child go to a dentist or start going to a dentist?
So traditionally it's been said 3 years old, but unfortunately we started seeing a lot of children under the age of 3 with cavities. So now the American Academy of Pediatric Dentistry recommends that as soon as the child has their first tooth, which could be 6 months, it could be a year, that they come and see us.
Really?
Just so we could talk to parents about certain things like not letting them go to sleep with a bottle, whether it's milk or it's juice. We also want to kind of warn them, yes, we want to kind of try to warn them about not giving them too much juice throughout the day, because a lot of parents think, well, we water it down. It's a lot of water. It's mostly water and it's just a little bit of juice. But even if you water it down, all it really does is alter the taste. Not really, it doesn't take away the sugar. And with juice exposure, it's very important. It's better for them to have a full strength cup of juice once a day than juice throughout the day.
That's watered down. You're feeling like that's better.
So it's all about the exposure.
Right.
So we try to warn parents about that. We try to warn parents about fruit snacks and raisins, things that are, supposed to be good and healthy.
Things that every kid loves.
Yes, ma'am. That every kid loves, but it can cause cavities.
Okay.
Fruit snacks, gummy vitamins, raisins, just things that you don't really think about. You
Right.
always think about, candy,
Right.
sodas, things like that.
Right.
So we try to see the children earlier so that we can kind of warn parents, because the ultimate goal in seeing the children earlier is to
Right.
prevent cavities. If they're going to have a cavity, it's so much easier if they're 6 or 7 versus if they're 2.
Right.
So that's why we want to see them
I should
earlier.
ask that question. I don't know if I want to ask the question about how to take care of a cavity with a 2-year-old, but I have my daughter is your patient, and also I have a son, and he's going to be 1 in a week or 2.
Okay.
So our pediatrician recommended coming at a year, at the first year, and we didn't come to you until Rhea was like almost 3 years old.
Yes.
But my son is almost 1.
Really?
I know. What should we expect? So that was my next question. Like, what should we expect at that first visit if you have a 1-year-old? Like,
Sure. So with a 1-year-old, we try to make it as stressless as possible, stress-free.
Okay.
So pretty much, what we typically do is I just brush his teeth rather, with just a regular brush.
It probably is 2. Well, he has 2 teeth.
Okay, yeah, so it's 2 teeth.
Yeah.
So pretty much, I would brush his teeth with a fluoride-free toothpaste.
Okay.
And then I would apply a little bit of fluoride to his teeth. Very stressless for you, for him, but just to kind of get him used to coming here.
Okay.
Because the more he comes, the more comfortable. Because at those ages, when you come in contact with someone like me, I'm a stranger.
Right.
So the more that he comes, the more comfortable he becomes,
Yeah.
and the less tears. Like I have 1-year-olds that come and just you sing to them and they're fine. Then you have some that are a little bit who are a little bit more apprehensive, and it's all about exposure. Them seeing.
You have adults that are scared of the dentist.
Yes.
So I can imagine if you start early, then you can take away that anxiety. So completely. Do you have any kind of, and this is a question that's not on this, but I'm sorry, but I was just thinking about my son. Is there some kind of paste or something or cover that you put over there to like protect it from things?
So,
because I've heard.
So pretty much, at your son's age, it would just pretty much be the little fluoride varnish.
Okay.
Usually around 2.5, 3, all the baby molars are in. Okay. And then that's when we get into things called sealants. And those are the protectors that go in the grooves of the teeth. Okay. Now, unfortunately, it's a very good preventative tool. Right. But most insurance companies will not pay for sealants. So usually if you want sealant, that's an out-of-pocket expense. Right. But once they get their 6-year molars, 12-year molars, they will cover the sealants then. But baby teeth, they don't do that. But but again, the main thing with preventing cavities on the molars is just the sticky candies, reducing that. Okay. Not letting them have fruit snacks all the time. Staying away from Starburst. Really sticky things that go inside the grooves of the teeth. Okay. If you can avoid that, then we don't need the sealants.
I'll try to keep the candy away. I don't know if that's gonna happen.
And I'm not one of those unrealistic people who are like, never have candy. You can't ever have candy.
Keep it away. Everything, every holiday,
birthday parties, there's all kind of things. So it's not something that you can just completely keep the child away. Right. But another tool that I'll tell parents that come here is water. Yeah. Water is like your best friend, especially when it comes to preventing cavities. Yeah. Drinking more, swishing it around, kind of neutralizing any sugar that you may have or come across, but water. Yeah. That's the main thing. Water. Okay. Lots of water.
Lots of water. Yes. What are some tips to help kids keep their teeth clean? One thing that I heard you say as we got started was about drinking the milk, and I will go ahead and admit my daughter drinks milk all throughout the night. Okay. I mean, she's 3, and she still drinks milk all throughout the. And I know that's not good. I know. I actually went to your website and I saw that on the website. Like, try not to let them drink milk throughout the night. Yeah. Because I guess it sits on their teeth. Yes, ma'am. But we are completely guilty of that. Yeah.
So again, if you could try to get her to drink more water in between it. Also, I got these little wipes, and you can get these from Amazon. They're called Spiffies.
Okay.
They have Dr. Talbert's wipes, just little things that you can wipe your teeth with at night, especially. Yeah, especially like the little ones, like your son.
Like wipe their teeth off with this.
Yes.
Can I take
Yeah, sure. Sure. Whatever you like. That's what they're here for. But water, because you can't always
towels.
Yeah. So you can get like little wipes like this, especially for moms who like breastfeed. You know, especially if their child is eating every 2-3 hours. You're not gonna, after he's done, go get a toothbrush and brush his teeth, but you can wipe his teeth. Wipe his teeth, wipe his gums. Now with your daughter, because she's 3, does she usually wake up in the middle of the night?
I think almost it's like muscle memory. Like she wakes up and it's the first thing she says, like, milk, I want milk, I want milk. So I'm thinking, like, after hearing you say this, I'm thinking about maybe giving her water instead and see if that would just crave that. That would be
because
so much she drinks probably about 3 cups of milk throughout the night. Like she'll wake up maybe twice and
just try to that last cup be some water.
Are we gonna be
try to wipe? But milk is not a bad thing, and see that's usually when you start adding stuff. That's when you start adding chocolate syrup, when you start adding strawberry syrup and things like that. So plain milk doesn't have as much sugar as chocolate milk or strawberry milk. So it's not totally bad, but you definitely want to try to incorporate some more water into that. Some wipes. Preferably brushing her teeth. Right after, and just be like, okay, that's it, and brush her teeth. And then if she wakes up in the middle of the night, it's water, not the milk.
Right. Okay. So that's helpful tips. Thank you. And what age is flossing necessary? I think last visit that I came here with Rhea, you said you may want to start flossing because I guess it's when their teeth start touching, or
yes, ma'am. So with flossing, traditionally by age 2.5, 3, they'll have all their molars. So flossing is a really big thing for the back teeth. Because a lot of times with the front teeth, they're very spacey, lots of gaps. So it's not really like necessary. You still want to get them in the habit, but it's not one of those things where you do every night if they have a gappy smile, like lots of spaces. So let's say with your baby, but it's not the case, her teeth do touch, so you have to start with the flossing. But let's say she had spaces even in the very back, then it's not something that you have to do every night, but you still want to try to get her in the habit, because we're trying to make sure that once her permanent teeth are in, she's flossing. So
and
by 3 for sure, I would say
flossing.
flossing.
The little picks or
Sure. The picks are the easiest way to show a child how to floss. Because with the strings, pretty much it's challenging for some adults. And I was taught that pretty much if a kid can write in cursive perfectly, then they can floss. It's all about the hand skills. They can floss with the string. So a lot of people don't have
writing in cursive.
So a lot of people don't have the hand. A lot of kids rather don't have the hand skills to use the floss. So the picks are much easier for them. And even then, you still want to kind of be there watching them while they're doing it. Because I'll come across a lot of parents and the child is 2, especially when they're 2 and they're very independent and they want to brush their teeth by themselves, and that's fine. But you still have to go behind them, watch them, make sure they're doing it perfectly.
And that was kind of one of my questions also, like, when should parents stop following up behind their child? Because it drives me crazy. Like, I let her do it, I watch her do it, and she's really good. But I'm like,
high school in their house. Because they'll be fine. Like 8, they'll be brushing, they'll be fine, and they get to hit the preteens, they hit the teens, and sometimes you still have to look at them.
Did you brush your teeth? Because they feel like you don't have to do it every day.
Exactly.
Like, I gotta brush my teeth again.
Exactly. And growing up, my dad was really big on that. Like he'll look inside, go back and brush. Go back and brush. Like that was until like I graduated from high school. I always made sure I was very like diligent because I know he would be like watching us and looking at our teeth. So
my dad was
pretty much you're gonna be doing until they leave the house. You're gonna still have to kind of like look and make sure. You know, when they become teens, they start slacking a little bit. And that's also the age when they start getting braces. So you really gotta be on them, making sure they're brushing and flossing.
Right.
Not necessarily doing it, but at least looking and making sure.
You hear that, parents? We're never off duty.
You're never off duty until they're out the house, pretty much.
Wow. Okay, so I have another question about the plaque tablets.
Okay.
So they have these little pink tablets you can put in your mouth and it shows you where the plaque is. I remember doing it when I was younger, and I'm trying to figure out, should I be doing that with my daughter?
Okay. So the plaque tablets, very good tool. I would not use it with your daughter because she's so little.
Okay.
And it's one of those things when you do it, I wouldn't do it every day. It's very difficult to get it off their teeth. The pink stuff, blue, whatever. It's very difficult. Like I'll give parents some of the tablets and I'll say, okay, do this on a Friday.
Yeah, when you got time.
So you have time, so they have time to really go in there and get it off because it will really stain the teeth.
Right.
So pretty much I recommend like through the week is something like a Listerine, a Smart Rinse. Because it will stain the teeth.
Okay.
It will stain the teeth. It will show you, but it won't be as intense, and it won't take 20 minutes to get it off.
And I'll admit,
those disclosing, the disclosing tablets, it takes a long time.
That's one thing I have not incorporated. Also, is mouthwash.
Okay. So with mouthwash, I wouldn't recommend for your baby just yet because she's just 3.
Okay.
Usually, a mouthwash is around 6.
Okay. Okay.
Because we want to make sure they're not swallowing it.
Yes.
Want to make sure like she can swish around like she needs to and spit. Because if she just put it in her mouth and spit, it's still not really helping.
Really doing,
So 6 is the typical age that we recommend like mouth rinses.
Okay. Okay. And then that will help with the plaque.
Yes. Okay. This will show you the areas where it turns blue. Those will show you the areas where we need to work a little bit harder to get the plaque
so
off.
that works like the pink tablets. Yes. So you switch that around and then afterwards you brush
then
the
it
areas
turns all blue.
And
then we need to spend more time in the back up at the top by the cheeks. So it will really stain the areas where there's plaque.
Okay. Okay.
So it's just as good as it's just as effective as the disclosing tablets, but it's easier to get it off. Like those.
And you say you can get that at any grocery store, HEB.
Yeah.
Whatever.
As opposed to the disclosing tablets where you have to do something special to get them, but anywhere you can get this.
Okay. Okay. Sounds good. My last question. Sure. And this question just came up this week because I've heard some parents chitter chatter about things, but how do you address the issue of these are just your baby teeth?
Very good question.
Let's not worry about those baby teeth right now. And I know as parents they still try to take care of the teeth, but some parents are like kind of lack a little bit because they're like, they're just baby teeth. They're gonna get their permanent teeth and be all right.
So
they'll get another set later in life.
So the only problem with that, and I hear that question all the time. The only problem with that is like, let's say your child is 5 years old, they get their first cavity, and I'd rather them be 5 than 2. But let's say they're 5 years old and they get a cavity down at the bottom, a back molar. That tooth is going to be, let's say the very back, the last molar, baby molar. That tooth typically falls out around 12. So a lot can happen in those 7 years. And a lot of people don't realize is that as far as like cavities and it's like a bacterial infection. Cavities will jump from tooth to tooth.
Wow.
It could, and in 7 years, that tooth could get really bad. It could cause the child a lot of pain. Pain that is so unbearable that it'll affect them in school. You have to think about that. Anyone who's ever experienced dental pain knows like it can be sharp. It can be very painful. It's hard to concentrate. So we got to keep that in mind. Also, as the cavity will continue to grow,
Right.
there's always the risk of infection.
Right.
And we don't want that. You don't want your child's face swelling up.
Yeah.
And not to scare parents, but you have to also, like, again, you have to think about how long this tooth is going to be in there.
You gotta be mindful
If they're
of those things.
if they're 2, and again, even if it's a front tooth, the front teeth typically fall out, the bottom around 6, the top around 8. If they're 2, that's still a long time.
Right. Right.
So at the bare minimum, you want to at least make sure that you're seeing the dentist regularly, that they're able to let you know, okay, it's close to the nerve. It's because some parents still choose not to get the work done.
Yeah.
And I don't pass judgment.
Right.
I still want them to come in because I want to see as it progresses.
Right.
Because you never want your child to have an abscess. You never want them to have an infection. You never want them to come in here and their jaw is super swollen and they're in pain, So
I mean, what's the youngest you could get a cavity? Like, what's the youngest
patient that I saw with a cavity was around 15 months.
Oh wow! And did you fix it or did the parents choose?
So it really depends. Unfortunately, if it's a whole bunch of cavities, then I've had to fix it. And when they're young like that, it's not really anything where you can give them, you pretty much have to put them to sleep, unfortunately.
Oh God.
And again, another reason why we want to see them earlier, because at that age, pretty much under 3, you're putting them to sleep.
Yeah.
Because they don't understand, they can't process things like the same way a 6-year-old or a 5-year-old or even a 4-year-old will process things.
Yeah.
So at that age, 3 and under, they're pretty much going to be put to sleep.
And then the recovery is probably tough too, because I mean, even for an adult, when we get a cavity fix and that, what is it called? The stuff wears off. The pain medicine wears off.
That lidocaine wears off. Yeah. So it's just a difficult process.
Whatever it is, yeah.
So, but if it's 1 or 2 teeth, I may not treat it right away. Probably wait until they're a little bit older.
Okay.
Do little fluoride treatments, kind of monitor them. Go over dietary instructions, things that we can do to slow down the process, because it's a process. When you get cavities, it's a process. It starts small and then it eventually gets bigger. So then we'll talk about things like, okay, they can't have juice. It's just absolutely no juice, because if we're having juice and we have cavities right here in the front, it's just going to get worse.
Right.
So it just kind of depends on the amount of decay, because sometimes you can't help it. If they have a whole bunch of cavities, then you have to go in there and you got to do something. You can't just monitor it and do things.
We got to take care of this.
That was a great question. So that's the reason, why pediatric dentistry was created, to just, address the needs of the baby teeth, because again, a lot of parents think, they're milk teeth, they're gonna get that too. So but you still want to take care of those teeth. You want to try to make sure that the issues, if your child does have a cavity when they're little, when they're older, they don't have those same issues.
Right.
So yes, they're practice teeth, but we gotta have good practice.
Good practice. So when they get the real teeth,
so then when they get their adult teeth, they'll know what they're doing. They already know. Okay, I have to floss, because cavities, there's a environmental component, but then there's also just genetics. I've seen kids who don't brush their teeth, never get a cavity. I've seen kids who are very good with their brushing and their flossing, and they do get cavities. But it's just all about coming here or any pediatric dentist and establishing good habits.
That's funny that you brought that up, because I was the kid that brushed every morning, every evening. My dad was big about keeping my teeth clean, but I always had cavities. Every single visit I would have cavities. But I had a friend that brushed her teeth once a day. Yeah. In the morning. Never had a cavity.
And never flossed.
I said, that's unfair. It really
so genetics play a role. So for someone, like if I saw a child like you, then I know like we have to be. So genetics is kind of against us. So environmentally, we have to just figure out like what are you eating, what we can do to kind of give you an advantage. Kind of
to come in one day and not have.
It's coming. What do we have to change so that you can have your cavity-free visits.
Yeah.
Yes.
It wasn't until I became an adult that maybe it was poor brushing habit. I don't know what it was, but I know I was doing the work, but but anyway, that's just my childhood.
Okay.
I appreciate
and we'll make
so
sure
much.
that your son and daughter don't have those same
Thank
same issues.
you so much.
You're very welcome.
I appreciate you so much for coming and letting me come into the facility. And I'm gonna, if you don't mind, I would like to do a little tour where I could just because this is one of the best facilities I've ever seen, like pediatric or adult. Like, this is a beautiful facility. It's so organized, so like advanced, like and paperless.
We try our best to have happy kids.
Yes.
You know, the kids, every time they come, we want it to be a happy, pleasant experience.
Right.
You know, sometimes it doesn't go that way. Sometimes they're nervous, but we want them to walk away knowing, it wasn't that bad. It wasn't scary, and I can do this.
Yeah.
A confidence boost for them.
Thank you so much,
Dr.
Grace.
Thank you.
Thank you.
Thank you.
Well, I hope you enjoyed that interview, and I wanted to give you a few details about what will be included with this poster. I do have a toothbrush and toothpaste, and I have one for little boys and one for little girls. You will also get the infant flossers, which my daughter has just started using these because she, as you heard in the interview, she just turned 3 and her teeth in the back are starting to touch. So she has started using these, so I will include these. I, of course, have the stickers. I have 2 sets of stickers that you can put on your poster, along with the marker and wipes. I also, since in the video we were talking about the wipes you can use to wipe off the teeth, I had to include those. So I do have a box of these that I will include in the box as well. And a new thing that I'm adding is the timer. Now this is a bonus. We haven't used this yet in our brushing our teeth adventure, but this is like a little timer to make sure that your children are brushing their teeth for the correct amount of time. I know with my daughter, sometimes she's like, okay, I'm done. So this will be cool. I just ran into this, so this will be cool to see if we can get her to at least brush her teeth for 2 minutes. So I'm really curious to see how this works, but I would include this in the box as well, so you can tell me how you feel about it. I would love to hear feedback about how it works with your children. Thank you for taking the time and joining us today. I hope you learned something and gained some useful information. Again, follow us on our platforms on Instagram, on Twitter to learn about our new products as they come out. And as always, I hope you have a good day and thank you for your support. Bye.